3.
Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are sharing with you a way to study smarter and not harder. We're going to try to use an example from our textbook involving electrolytes to show you how, if you know one principle, you can avoid memorizing endless lists of signs and symptoms.
Now, before we prove this to you, as always, we invite you to subscribe to our live videos so you'll be notified whenever we go online. You can also subscribe to us on YouTube. You're going to find there tons and tons of content-oriented videos. Like and share this video with your nursing friends, and be sure to follow our Facebook page and check out our website at www.n-powermentnursing.com, where you can experience our free trial as well as check out our complete study packages. So, we are going to prove to you that if you know one concept, you can avoid, I'll show you actually how many pages. 1 full page, this is our textbook, and 2 full pages of our entire textbook. I don't know about you guys watching, but I always hated to memorize fluid and electrolytes. And that's because it was just all of these lists of hyper this and hypo that and symptoms of this and symptoms of that. Now that I've been teaching it for a number of years, there's a way to teach it that you know one thing and you know all of the things, especially when it comes to magnesium and calcium. I know you think I'm crazy, but I'm not. I reassure you. I'm about to prove it to you. We're going to use magnesium and calcium as an example. Did you know that magnesium and calcium behave identically in the body? So we're going to switch now to the iPad, and I'm going to prove this to you. So we're talking about high levels of magnesium and high levels of calcium. They do the exact same thing. So hypermagnesemia or hypercalcemia is what I'm referring to here. Okay? Here's the only thing you need to know. High levels of magnesium or calcium cause sedation. Cause sedation. I'm going to say it again. High levels of magnesium and high levels of calcium will sedate your patient. Okay? Meaning hypermagnesium or hypercalcemia will cause sedation. Here's how I'm going to prove it to you. Here's the signs and symptoms of high magnesium or high calcium. Okay? Symptom number 1, sedation. Symptom number 2, decreased respirations. Symptom number 3, decreased pulse. Symptom number 4, decreased level of consciousness. Number 5, decreased deep tendon reflexes is what that stands for. And number 6, flaccid muscles. As you can see, all of those signs and symptoms are sedation. All of them go down. So literally, if you can know high levels of magnesium and calcium in the body will cause sedation, you know all of this. Now here's the more beautiful thing. If you know high levels of magnesium and calcium cause sedation, then you would know automatically that low levels of magnesium and calcium do the opposite. So what would the opposite be? If we have low levels of magnesium and calcium, we would have the opposite of sedation, which would be hyperreflexive. We would have increased respirations, increased pulse, increased level of consciousness or hyperactiveness, increased deep tendon reflexes, and we wouldn't have flaccid muscles, we would have spastic, seizure-like muscle activity. So, there you have it. Just knowing that magnesium and calcium and high levels in the body cause sedation, you automatically know the signs and symptoms of hyper and hypermagnesia and hypercalcemia. And in knowing that, you also know the opposite of if it was low calcium and low magnesium, you would have the opposite of sedation. So just in knowing that one phrase, you have all of that knowledge.
Can you believe it? Honestly, to be able to be succinct like that and understand several pages of content with just knowing
One thing.
that one thing is incredible. Tied it into all just one sentence.
This is one of those things I can honestly say, and I think Linda would agree, that students will say, oh, I wish I would have known that. I wish I would have known that, right? I wish I would have known that high levels of magnesium and calcium sedate the patient. Then I wouldn't have had to do all of that memorization, and now it all makes so much more sense to me. So it's one of those great moments in the review where students are like, aha, right? An aha moment. If you like the way we teach this, this is the beauty of everything that we do. All of the concepts that you need to pass your registration exam, we teach the same way. Make it as simple as possible for you to remember so you can study smarter and not study harder, so you can deeply understand and critically apply concepts. That is our goal, and it's also super fun how we teach. If you need all of this information, we have complete packages for NCLEX, NCLEX-PN, as well as the CPNRE, complete course packages, and we guarantee you'll pass or your money back. Thank you so much for joining us. We really hope this has helped simplify magnesium and calcium for you. This is just one example of how we make complex concepts super, super simple. So we will see you next time on In the Know. Bye for
Bye
now.
for now.